Chill, Bumble. Bumble might have an internal ear rupture or skull inflammation.
The best thing to do is to image the whole skull.
Driving out to my mom's farm.
New beginnings call for a smudge.
She's the first one from our reserve to be a veterinarian.
My cat Tippy is in the clinic. It's always scary to bring her in. There's this one spot here. Worst case scenario, it is a type of cancer. I cannot imagine life without Artie.
Across the country,
Be nice.
Indigenous vets are using their knowledge and skills
A good little baby.
to help the animals we love stay happy and healthy.
Good boy.
Outlaw is one of my many fur babies. I brought Outlaw in today because he is getting neutered. He's a 1.5-year-old golden retriever.
Oh, are you shy?
He just likes to cuddle.
Oh, he just likes to ostrich into you.
Yeah.
Okay.
Outlaw's super cuddly. He loves attention so much.
It's very sweet.
He just means the world to me.
Hello. Eating and drinking well?
Yeah.
He's obviously a healthy weight, so. It doesn't matter if you're a client or if you're a team member that I work with, I put my utmost care and attention into each and every patient.
The only thing we checked his,
Okay, he's gonna have a feel of his tummy. It's not even attached. Outlaw has the little bleb that's sitting outside of the abdomen.
it's like a little outie belly button.
Yeah, it's so small, honestly, like, it'd be pretty simple to remove. We're already knocking him down for the procedure. Good boy. It's better to remove it just because the sooner we can figure out what it is, not only does that put your mind at ease, but it also allows us to have some options on how we deal with it.
This fits.
That was like the perfect little circle. I know, it's pretty cute. Okay, you ready if I cut?
Being a client, it was definitely weird. Yeah. It's like every other surgery that we do here, but it's different because it's my dog.
All right, the neuter is done, and now we're just gonna remove the little nubbin. What a weird lump. I wonder what's in it. I bet there's fluid in it. It feels pretty squishy.
We can open it.
You sure can. Whatever it is.
All right, let's cut into this bad boy.
Yeah.
I opened up the nubbin once we removed it off of him, and a bunch of like purulent, greenish, brown liquid came out.
Was it like a pus ball this whole time?
Okay, good thing we took that off. Anytime that we have a weird, unknown fluid coming out of the body, it is important that we have a peek at it under the microscope. I don't see bacteria. My best guess, it was some like productive cell that just got trapped in a spot where it shouldn't have. I think maybe it was some cells that secrete sebum, like a type of oil for the skin, and that they basically got trapped underneath the skin. Let's go, bud.
Outlaw, come on, let's go.
Here we go. We will keep an eye on that area and make sure that it doesn't come back. But I suspect that we got everything and that he should be good to go.
Good boy. You're okay. It didn't bother him none, but I'm glad it was removed because you never know.
I know.
Good boy.
Okay, chill. ARCS is a nonprofit charity, and they work with animals who don't have homes or have been rescued and essentially try to find them new homes and veterinary care.
Oh, goodness.
Today we're looking at 4 little kittens. They were surrendered and they look really, really cute right now. They're all set with vaccines and deworming, and we're going to be neutering them.
This is Bahir?
Bahir. Bahir is pretty happy, healthy. No.
Of course.
The only thing I did find is he had a retained baby tooth. Which one was that? Top right. Bahir is a 6-month-old kitty cat. Most cats tend to lose their baby teeth by like 3 to 4 months of age. So typically if they stay longer than that, there might be something going on.
104?
1, 2, 3, 4. 5. The biggest risk is it can cause issues with the adult teeth that are coming in. And based upon his age, it's less likely that it's going to fall out on its own. I suspect it's probably has a pretty strong root.
Are we ready to pre-med then?
Yeah, we are. Do it, we'll do it. I want to get a better look at Bahir's tooth when he is sedated and not moving as much right before his neuter.
And I have your bupivacaine right there.
Oh, it is mobile. Oh my God, this might be the best day ever. It's very mobile, so it can move around. I think I can just pick it out like this. Oh my, yay, it came out. Bahir's tooth was loose right away, and it took very little effort for it to come out. Pretty much it was going to fall out on its own, whether it happened in the next day or so, but it didn't really need my intervention to do so. God bless. All right. Essentially, it just fell out on its own, which is the best case scenario. After they recover from the neuter today, they're going to be pretty much all set to make their way into their new homes. All right. When I'm at work, there's always a new challenge, and I'm constantly pushed out of my comfort zone, so it makes learning fun. So scared.
Classic stress behaviors. She's panting, she's avoiding eye contact, and this is them both on the anti-anxieties already. I feel like this on the inside, yeah. Today I brought in my 2 dogs, Artie and Charlotte. These are the most important dogs in all the world. Yeah. Artie and Charlotte make me feel like I have purpose and that the purpose is good.
Good job, Artie.
Artie is almost 10 years old. We've been through a lot together.
Anytime anyone's bringing a pet in and trusting us with their care, that's always a really big honor, especially when it's your team member and especially when you know how much they care about them.
Oh, thank you. The worry with Artie is this skin condition that is not healing the way I expected. There's this one spot here that the hair is a different texture.
And she's been chewing at it?
Yeah. This one was bleeding on Tuesday.
And then there's one over here.
Yeah.
I don't know what's going on. They almost look like hot spots.
Hot spots are skin infections. They can happen for a number of reasons. Then they look crusty and they are often hot and red. The animal just keeps licking at it, keeping it moist, and it can get really big, really bad, really fast.
You treated them, and to me they look like they should have cleared up like normal hot spots.
Yeah. So that with all the like multiple weird skin things, I was starting to get worried about like melanoma and things. Melanoma is skin cancer, and with Artie being a little bit older, she's more susceptible to have those things. I think I'd probably just skip to like a biopsy. Okay.
I think as veterinary professionals, we all very quickly spiral to the worst case scenario with our own pets. Those are real things that could absolutely be going on. We're gonna start there, then we'll work our way down before we panic.
Trying to keep my emotions out of it is actually the most difficult part. I cannot imagine life without Artie. Definitely can't. Artie is my soft spot, that's for sure.
I think this bunny might be spicy.
Bumble was a bunny that I saw over 2 weeks ago for an ear infection. Arx had mentioned that maybe the ear infection wasn't completely healed, that there's something else going on, like an internal ear rupture or skull inflammation.
I keep him like a football. I literally took him in like that.
So we are rechecking the ear today. All right. Chill, Bumble.
You got it. There you go. Yeah, no, good job.
Squisher.
Yep.
Today is a special day because Alice is coming in to look at our exotic animals.
My name is Alice LeBron. I am a special interest veterinarian. My personal focus is treating companion exotic animals, so reptiles, birds, rodents, and bunnies.
This ear canal is more stenotic, so I can understand why it would look dirtier.
So this ear, okay, a little bit abnormal, and so I think the best thing to do is to image the whole skull. And then you get a sense of, is there like a migrating form of disease?
My experience with exotics is probably a little more limited, and Alice is very well trained and knows what she's doing for exotics. She's a great resource to have.
Let's try that. Beautiful.
That looks pretty good.
Yeah, that looks great. Okay. I'm looking at the inner ear structure of this rabbit, and the structure is very normal, so I don't think that there's reason to sample its ears any further. On the x-rays that we took, they look very normal. I think whatever was going on there earlier has probably been treated.
Okay. There's no evidence of an internal ear rupture or internal skull inflammation, so pretty happy with that result, that we were able to treat the ear infection. Don't have to worry about it much going forward.
Sophie.
So is this like a fancy rabbit?
She's an Angora rabbit, so she's growing a longer hair coat.
Do you have to like groom it like once a week type of thing, or more?
Sometimes even more. I like the little diamond on the nose.
Yeah.
And I would go on either side into the apaxial musculature.
All the way in or halfway?
Probably about halfway.
Okay. Alice is a good teacher.
Good job, Sophie. Tough cookie.
And she's very patient and really knows what she's doing.
That's perfect.
And it's always nice to have someone that you can ask questions to and get an answer for.
It was so amazing for us to have Dr. Alice and Dr. Emma here to collaborate on our exotic cases.
Overall, today was really good. Yeah, I had fun, learned a lot, and then we got to help some exotic animals that needed the help. So it's a lot of good all around.
You're so cute.
We're doing it.
Today, Shanna is bringing in Artie to have her sedated for a couple of skin tests.
I'm in the dream. This is the most stressful day of my life.
My own cat, Tippy, is also joining us in the clinic today. She's my soul cat. She is just perfect in every way. But I know she's in really good hands, so I have to stop panicking about it.
Dr. Allison and I made a deal that we would bring in our most attached pets together so that we could help each other through the emotional toll of working on your pets.
1, 2, 3. Okay.
Good. Doing a skin biopsy on Artie. She's had a few little weird skin things that are going on. We're going to look a little deeper at the cellular level.
Tippy was brought in because she is due for her yearly checkup. I like to do this when she's completely sedated, as she's already a little stressed coming into clinic. I know that my team is amazing, but it's still always scary to bring her in.
Do you want to hold off the back leg for me, please? Good girl.
I absolutely feel for Shanna. Artie is her soul dog. I definitely understand her stress.
Do you want to have a lay down? Had to sedate Artie. It's always very stressful.
Good job, good job, good job.
For Artie, my heart is definitely on my sleeve. If you lay down, you might be sleepy. Oh, that's a good girl.
Biopsy is a little sample of the area of concern. My main goal for this test today is to just rule out the big and scary things. I'm doing a punch biopsy to take a small sample.
So that skin looks fairly normal. This skin starts looking a little dark. So good so far, sweet girl.
Shanna on the outside is keeping it together. I can only imagine on the inside that she's pretty anxious and nervous.
This is normally hair up here?
Yeah, that's weird hair. Yeah. The hair is growing in a different color and a different texture, and I don't know what that could mean, but I feel like it's not great.
Okay.
We took 3 biopsies today. 2 of them had me a little bit worried.
This biopsy is fairly open-ended at this point.
Oops, you're awake.
Worst case scenario, it could be that it is a type of cancer of the skin.
With Artie being a little bit older, she's more susceptible to skin things.
There we go. Be a good girl. I was freezing.
Okay. At least we're on our way to having. An answer.
Driving out to my mom's farm, that's where I learned how to drive, was on this road and in the field between my house and Saddle Lake. I have been working a really busy job. It's nice to come back here to just relax, unwind, go horse riding.
Emmy! Hello! You're home! It's been forever.
Right now we're at my family farm where I grew up as a kid. It's about 1 field away from Saddle Lake Cree Nation. Hello, hello!
Nancy.
See you, Tom.
Good to see you.
Oh, your hand, what happened?
Oh, I got hurt. I needed a vet.
Hi there, Emma.
Good to see you. How you doing? Cider made it okay?
Cider made it just fine.
Oh,
yeah.
good. Well, it's good to have you home.
Now, what kind of tea does everybody want?
When you go to a visit someplace, they always give you a tea and bannock.
Yeah. Coming home always feels good. When I first started my undergrad, I was 17 and I had to move to Calgary for it. It was tough being separated from everyone that was here. Family support's really important.
This is the new barn, completely renovated. New beginnings here.
Yeah, it is.
Yeah. New beginnings call for a smudge and a prayer.
Mutawimo, nanaskumun, hemiwasi kiska kemia, nanaskumun, epimiwichiwa koguta, nitem.
My Uncle Pete is my dad's cousin, and he's a really big cultural significance in my family, I guess, because I don't have the biggest connection with my dad right now. Pete's always been there.
Hi, mamutawimo.
Oh, hey.
Thanks, Pete.
You gonna smudge the horses too?
Let's try. First, we gotta catch them.
Can you whistle? Do they come when you whistle?
It's against the wind, so
yeah, it is,
they're not
eh?
gonna hear. Shady! Smokers! Come on, boys. Emma has always loved animals since she was a little baby. Come here. Come on. There you go. At about age 5, when she knew what a vet was, she decided she wanted to be a vet. Easy, old timer. There you go. I knew it was going to be very difficult. It's very competitive, but when she makes her mind up to do something, she gets it done. Ready for the saddle?
Yeah. My mom has probably been my biggest supporter, but I always felt like there was a lot of support from Saddle Lake. After I graduated, I was invited to come to Saddle Lake's round dance as a keynote speaker. I had to stand up at the front and give an address, and they introduced me as my name's Emma Jackson, and I'm the first veterinarian from Saddle Lake. And everyone stood up and started clapping. It was a really cool moment.
Easy, boy.
She's the first one from our reserve to be a veterinarian. I think she's a role model. I'm really, really proud. I'd do anything for her.
Want to look at Artie?
Yeah. Do I need tissues?
This morning, I'm going to share with Shanna the results from the skin biopsy that we took from Artie.
Worried is what I'm feeling right now. I'm so worried it's going to be something terrible. I cannot imagine life without Artie.
From what the pathologist has shared, it sounds like that darkening and weird hair is a result of inflammation. So it looks like it's some bacterial infection and it's healing up on its own.
That's great.
I know, I love it. Look at this. All 3 biopsies share features expected with healing superficial inflammation.
Right. Real slow healing.
The significant contribution of self-trauma.
Yep, she's been bothering them.
I'm glad we ruled out big and scary things.
Yes, that is not melanoma like I originally jumped to.
Skin issues are so challenging because there's so many different reasons that it could be an issue.
Is there any other skin support we should be trying?
Let's try some Apoquel. Let's clean that area, and then as much as you can, try to not have her look at that area. Like, I don't know if she can wear like little pants or something.
Yeah, last time I did that with socks, she ate the sock toe off.
Artie, come on. We're gonna try some anti-itch medication with Artie, see if we can help her feel more comfortable that way, and we're gonna see how she does.
Okay, I like that plan. They're gonna be tired after this, but not because they ran around, because they worked really hard to get their snacks. I'm feeling much more relieved knowing that Artie's biopsies came back as non-cancerous. We'd have some ways to support her skin a little bit so she's not feeling so itchy. Artie has been with me since tech school. We've been through a lot in the last 9 years together. Seeing her grow old is wonderful and also very sad. In your bubble mode, but I'm really enjoying the time that I have with her.